is clinical professor of emeritus at UCSF, and she is on the state leadership team of Climate Health Now and co-leads the Voting for Climate and Health. She is heading the Medical Society Consortium on Climate and Health Subcommittee to create the Get Out the Vote toolkit for 2024. Next is Dr. Cynthia Mahoney. She is a retired nephrologist who practiced in East Bay and taught at Stanford, where she is retired clinical associate professor of medicine. Dr. Mahoney serves as a member of the climate and health team of Citizens Climate Lobby, and she's a co-founder of Climate Health Now and Voting for Climate and Health. Last but not least, Dr. Karina Maher. She is a pediatrician in LA who practiced clinically for 21 years before focusing on medical education. She has created board testing content for the American Board of Pediatrics on health impacts of climate change and as section editor for pediatric board study materials. She is one of the co-leads of Voting for Climate and Health. So with that, I'm going to turn the microphone over to Dr. Chen, Dr. Mahoney, and Dr. Maher.
Thank you, Hillary. Next slide, please. The United Nations Intergovernmental Panel on Climate Change warned us in 2021 that the human-driven global warming is causing a code red for humanity. Today, we from Voting for Climate and Health want to connect the dots. That climate change is a public health emergency. The AMA actually declared climate change as a public health crisis in 2022. That civic engagement and advocacy are powerful tools to preserve a life-sustaining planet, and that we, the health community, have a special role with using our trusted health voices. That voting is a cornerstone of civic engagement. When people vote, health improves, and that voting itself is a social determinant of health, another AMA resolution in 2022. When people vote, they can support health-promoting policies. Voting is a climate health and equity solution. Next slide, please. Cynthia and Karina and I did not learn about social determinants of health when we were training, but we now fully appreciate that the care we provide in our office makes up only about 20% of the factors that go into our health and well-being. Another 30% may be attributed to genetic and behavioral factors, and that over 50% of the influences on our overall health are determined by social, structural, and environmental factors. New slide, please. The ED plays such an important role in our healthcare system. It is a frontline acute care provider. It is a safety net for vulnerable populations and a leader in disaster medicine. The ED serves as the interface between the office and the failures of the social, structural, and environmental determinants of health. In this diagram, we can see on the bottom here that extreme weather events, air pollution, water shortage, global heat rise, and sea level rise can impact this next layer of the social and structural determinants of health by causing housing damage and insecurity, threats to livelihood, reduced equity, education and training disruption, supply chain disruption, and a destabilized government, which then can impact our health systems with the risk to our health, the health of the staff, damage to hospital infrastructure and supply chain. All these impact individual patients' health and outcomes. Next slide, please. The human-caused global warming from dependence on oil and gas production and use puts all of our health at risk, but some populations are more vulnerable and disproportionately affected. I'm going to go around in the circle and talk about all these climate change and social determinants of health, which may present as air pollution and increased allergens, extreme heat, drought, environmental degradation, wildfire smoke, degradation of living conditions, and increased social inequities, changes in vector ecology, food system impacts, severe weather and floods, and water quality impacts. If we combine climate change and vulnerability factors on climate-sensitive diseases, we can see the consequences in the ED. Let's consider extreme heat. If you are unhoused, an agricultural worker, or not able to afford air conditioning during one of our increasingly hot days, you may be more at risk for health-related illnesses, worsening respiratory distress, kidney failure, mental health deterioration, more assaults and homicide and trauma, and increase in preterm labor and delivery. When we look at wildfire and smoke, if you're a construction worker or any outdoor worker, a firefighter, or again, unhoused or have mental illness and cannot protect yourself from air pollution or wildfire smoke, you may be more at risk of asthma and other respiratory distress, cardiovascular events and death, and obstetrical complications. I got to throw that in because I'm an OB. So climate change is a health risk multiplier. Next slide, please. This is a great article that I'd like to refer you to from the Annals of Emergency Medicine from June 2020. It's a comprehensive list of, can you scroll down, Hillary? There's lots of diseases. No, okay, I guess it's not complete. But it has a comprehensive list of climate-sensitive diseases when combined with climate change exposures can result in a variety of presentations to the ED. And we'll put that link in the chat for you. This is a great article. So next slide, please. So what can the health community do? We, the health community, have a unique and trusted role. To truly care for and protect our patients, we must extend our professional efforts beyond the individual patient and advocate for the health of our communities and our home, the planet. We can use our trusted health voices to advocate for climate health and equity. Number one, we can educate our patients and policymakers on the connection between climate change, fossil fuel pollution, and health, and we can show them that their vote can influence our health. Number two, we can promote civic engagement and advocacy for ourselves, our colleagues, our healthcare organizations, and our patients. And later, Dr. Mahoney will give you more concrete actions that you can take. We, the health community, needs to vote. We can enlist our organizations to support civic engagement, and we can help our patients to register to vote. Number three, we can advocate by pressing our elected leaders on bolder, more equitable climate legislation and policy. And finally, number four, we can integrate civic engagement into healthcare settings by helping our patients register to vote. There's a striking overlap between the medically disenfranchised patients and those who do not vote. We see those patients who are most affected by the social, environmental, and structural determinants of health, and we can help them get registered to vote and become informed voters for health. Next slide, please. So, civic engagement refers to when people actively participate to improve the quality of life in their community. Civic engagement and advocacy are powerful tools that we, the health community, have to promote policies to preserve a life-sustaining planet. Laws and policies determine the conditions of our environment. The people we elect determine those policies. We can advocate our electeds for bolder climate action, and we can empower our patients to vote. People who vote influence their health outcomes. Again, voting is a climate and health equity solution. Next slide, please. This slide from Healthy Democracy, Healthy People show that states with more inclusive and more voting access have better health outcomes. On the abscissa is increasing voter access, going to the right. On the ordinate are better health outcomes. And there's a straight line showing increasing voter access is associated with better health. Next slide, please. We've discussed how legislation and policy can impact our health and how advocacy by our health community with policymakers is important and influential. Climate Health Now is a coalition of over 600 community health members who are engaged in advocacy with our state legislators and policymakers. This year, CHN has 4 statewide campaigns. AB 1866 is to cap idle wells that are leaking methane and other toxic gases. SB 242 is a bill requiring CalPERS and CalSTRS pension funds to divest from fossil fuel investments. But I'd like to highlight the 2 bills that you may be seeing on the November ballot that will be pertinent to you and your patients. Keep the Law is to get out the vote. To vote yes on the law for 3,200-foot setbacks between people and oil and gas drilling. This law was actually passed in both houses and signed by the governor last year, but oil and gas industry is mounting millions of dollars to confuse the voter and repeal the law. ACA 16 is a constitutional amendment to declare that the people of California have the right to clean air and water and a healthy environment. That just makes sense to me. Next slide, please. I will leave you on this slide that says voting is arguably the most important aspect of the political determinants of health. And here's Dr. Mahoney.
Thanks so much, Margie, for that excellent overview of climate impacts on health and on civic engagement. So yes, many have concluded that voting is the strongest social or structural determinant of health because it sets the conditions for all the other social determinants. So how do we do we health professionals, as voters ourselves. Next slide, please. Well, we were shocked to learn that an estimated 4 to 8 million healthcare professionals did not vote in 2020. Historically, healthcare workers vote 12 to 23% less than the general population. And although that seems to be improving, there's a huge opportunity here to get out the health vote. Next slide. Our votes matter in every election, not just in the general elections every 4 years. Take this health example. In Phoenix in 2023, they had 30 straight days above 110 degrees that resulted in an annual record number of heat deaths in Maricopa County, 645 deaths. And so what was done with that? Well, the local city council in Phoenix approved measures for outdoor heat worker protection, shade, rest, and water, that will really help a lot of people. At the same time, the legislature in Florida banned local workplace heat protections. So this is an example of small local elections, a city council that makes a big difference on health, and midterm elections that voted in the Florida legislature. So we need to vote in every election, yet an estimated up to 13.5 million health professionals did not vote in the 2022 midterms. So we realized this was a huge opportunity, and we need to step back and get our own house in order, our healthcare house, with voting. Next step, please, or next slide, please. So we were thrilled to discover the We Will Vote call to action, which is an initiative jointly by the Civic Health Alliance, Healthy People, Healthy Democracy, and the Vote ER group to promote voting in healthcare itself. And there are 3 stages. 1, encouraging voting for ourselves and our colleagues. 2nd, to enlist our organizations. And 3rd, to help our patients be informed voters. Next. So for stage 1, encouraging voting for ourselves and our colleagues, the first step is to check our own registration. We know a lot of the lack of voting in healthcare is because people change locations. They often don't get re-registered. And it's just good voting hygiene to check, even if you think you're registered, and then make a plan. So I'd encourage you to put vote.org into your phones now, vote.org, and you'll see really everything you need to vote. Next slide. So while you're doing that, this is what you should see at vote.org. And you can check your own registration. I'd encourage you to do that right now while we talk. If you're not registered, you can register. It takes less than 2 minutes. You can apply for an absentee ballot. That's not necessary in California because everyone gets mailed a ballot now, but in other states, that's important. You can sign up to get election reminders. And for the pediatricians here, it's lovely. You can get 16-year-olds can sign up to be automatically registered to vote when they turn eligible. So I hope you've had time to check your own registration. We'll give you maybe another 20 seconds. And let's go on to the next slide. And all of these links will be in the chat if you don't have time to do that right now. So once you've checked your own registration, and it's a good idea to check that again 20 or 60 days before elections because there are purges, things change, and make a plan to vote. The next step is to join the We Will Vote call to action by signing this pledge. So please scan this QR code and it will take you to the We Will Vote call to action, which I'll show on the next slide, but we'll give a few more moments to scan that QR code. All right, next slide, please. And this is what you'll see, the Thrive Through Civic Health pledge to vote. And there are levels of engagement. You can pledge yourself to vote in upcoming elections. And these pledges are important because it's actually been studied and shown that when people make a commitment, especially in public and with others, they're much more likely to do it and follow through. So pledge yourself to vote. You can pledge to encourage colleagues to vote as well. Approach them, and that can be the core of your civic health team, which we'll talk more about later. And then you can also pledge to approach your organization or your workplace. So let's move on to the next slide. So the second stage is enlisting organizations. So if you ask your organization to sign up, this is the pledge that they would take. Simply that they're committed to strengthening democracy by encouraging nonpartisan voter participation across memberships, employees, and affiliates. And this pledge does not demand that they do anything in particular, but that they do something. It can be as simple as sending an email to all employees and staff to remind them to register. It can be putting up posters for voter registration. It can be op-eds. Hundreds of organizations across the country are already involved in this, but there's so much more we can do. And if you're going to do this, it helps to find allies, what we like to call a civic health team, because it's not just climate that's involved here. Next slide, please. Whatever you care about, whether it's climate disruption, reproductive rights, healthcare access, gun violence, racism, health is always on the ballot. And voting is the most powerful tool we have to address all of these. Next step, please. So it helps to have your organization on board, because that kind of tills the field and makes it more likely then that they'll also be helpful in helping our patients to be informed voters, making healthcare settings a place where we can help our patients get their voice out for health. And one of the tools that we can use to make this easy is Vote ER. Next step, please, or next slide. Vote ER is a nonprofit, nonpartisan platform that provides tools for healthcare setting voter registration. They provide badges, like in the first picture, with a QR code that allows your patients to register themselves to vote. They provide posters and other paraphernalia that can be put up in common areas. And they also conduct a healthy democracy campaign, which is a competition for medical students and residents to get out their patients to vote. Next step, please. Sometimes it can feel a little overwhelming to think, well, how would I actually do this? How do I approach people? But Vote ER provides platforms, training, conversation starters that can be as simple as, why does your lanyard say vote? I can help you get ready to vote. Scan the QR code. Or we could have this, next slide, please. I'll go back to incorporating this in routine things like your social history. Do you smoke? Do you drink? Are you registered to vote? I ask all my patients because your vote matters for your health. And it's important to note that this is legal. A lot of people are familiar with the motor voter law, but that law also applies to non-governmental nonprofit entities like healthcare settings. So it's legal. Next slide. And it's mainstream. It's promoted by the American Medical Association and the Association of American Medical Colleges, which actually has guidance about how to do this in your hospital. Next, please. And we're excited to say that Epic has recently come out with the opportunity to integrate voter registration into the beloved electronic health record, and you can get help in doing that as well. This might be a great initiative to take for residents and students. Next, please. So we know that UCSF was strongly involved in voting efforts back in the 2020 election. I found this article published by UCSF talking about the UCSF Votes Initiative, the Voice Project, which really inspired us, and their collaboration with Vote ER back in 2020. And I see it was actually an emergency medicine resident who was involved in leading that. So I'm curious as to what UCSF is doing now and how much you residents have heard about this and what you see as potential for action. Next slide, please. So we'd encourage you now to get your own Vote ER badge, which you can do by scanning this QR code or entering the link. And then you can start to get involved with the Healthy Democracy campaign, which will start recruiting people in June. So we'll give you about 30 seconds to scan that. Okay. I hope that's enough time. Next slide, please. So we agree strongly with this quote from a recent BMJ article that said that ultimately the best way to protect people's health from climate change and air pollution is through public policies that address the underlying root causes. And we realize that to truly care for our patients, we need to recognize the social and environmental determinants that dominate their health outcomes. And although we ourselves are not responsible for solving the social determinants, we do have a duty to provide anticipatory guidance, a duty to advocate with leaders and educate our patients on the policies necessary to protect health. And doing this is really something that inspires me. I think it helps people, and it's been shown that people who take action have better mental health. They feel better. Action is the antidote to despair. So yes, it is beyond the compostable fork, but these are concrete actions we can take that will improve our health and improve how we feel about the overwhelming nature of the climate crisis. And not only that, it's fun. Here's a group of us joining together with our allies with San Francisco Bay PSR to give testimony at the Bay Area Air Quality Monitoring District hearing, which resulted in passage of groundbreaking indoor air appliance standards that are going to improve our patients' health and decrease asthma. So I'd like to open it up for questions and answers, discussion. Hillary, how much time do we have?
2-3 minutes.
Not as much time, but I can help with I can help you guys with questions, fielding them.
That'd be great, Dinah. Appreciate that. Questions for our excellent panel, and thank you for that important information and great presentation.
Any questions, guys? Yes. Ooh, I love this question. So the question was, for our panelists, what inspired y'all to get into this work?
You want to start? Well, I retired in 2018, and it was the time of the wildfire smoke and pollution, and wasn't even safe to go outside. And I had 2 brand new grandbabies. And I thought, what is happening in our world that we can't go outside, that they can't breathe air safely? And that just made me really worried about their future. And I found Climate Health Now in 2019. And it was a group of Karina and Cynthia were part of that group that spoke about climate change through the lens of patient care and health and safety. And I thought, well, I don't know anything about environmental health, but I do know about the health of my patients and advocating for patients. So this allowed me to get into this movement because I could use my health voice. And this is the argument we always bring to legislators and policymakers, that the policies that you are enacting impact our patients' health, our health. So this really spoke to me, and that's why I joined Climate Health Now. And so this is why I'm doing this.
Yeah, I'd say, I think physicians are really unique. We're at the interface between science and the humanities. So we understand the science and the danger of climate change, but we also care about our patients. And that gives us a unique position. We often say our voice is our superpower, our trusted voice. And I realized back when I was in practice at Stanford, I thought I was doing a great job anticipating problems, adjusting medications, preventing problems. And then one of my healthier patients came into the office with acute kidney injury after working through a heat wave. And I realized that the best care that I could provide as an individual was just no match for this. And as a physician, I could see what was coming up in the future, that this was going to get worse and worse, and that I needed to band together with other people. So I was so happy to find Climate Health Now and now our civic engagement group, Voting for Climate and Health. But I think that collective action and stepping beyond clinic walls, that is what's needed. And it gives me great joy.
Well, great. Thank you so much. I really want to thank Dr. Ong and Dr. Gandhi, who's not here, for really just doing such an amazing job with our climate health module. It's so important. And I really appreciate y'all. So thanks so much for recruiting such amazing speakers. And thanks so much to our amazing speakers. We really appreciate you. And hopefully you can hear the applause.
I want to extend that thank you again to our panelists. And if you're willing to share slides and your contact information, I'm happy to be sort of a linchpin. So if anyone interested in learning more about Get the Vote Out, your organization, please email me. I'm happy to connect.